The face of the pandemic in Manitoba is changing. Now it's the province's youngest residents who make up the largest proportion of new cases. And with the new school year in Manitoba beginning today, health officials are voicing concern. Laura McQuillan is on that story with us this morning. Laura.
Morning, Heather. Yeah, we've been seeing these numbers since mid-June, that group of kids aged 0 to 18 making up the most new cases in the province. That's been the case, as I mentioned, for a matter of weeks now. Our colleague Cameron McLean has been doing a deep dive into some of the data here to find out exactly what has changed in the province. And what he found is that prior to mid-June, it was mostly the 19 to 34-year-olds who were comprising the most cases, but that's really flipped in recent times. Under 18s now equaling or exceeding that older age group. And the reasons why, well, they might surprise you. Of course, vaccinations have changed the game. In Manitoba, they are allowing anyone who's 11 turning 12 this year upwards to get vaccinated now, but that leaves so many kids who are 11 and under still unable to get that protection. But in Manitoba, they also require that if someone tests positive for COVID-19, their household contacts would go get tested as well, even if they're asymptomatic, which kids often are. So they are showing up in these numbers as well in ways they might not in other parts of the country. The good news, of course, is that kids are much less likely to end up in hospital, and looking at the Manitoba numbers, it's around 1% of the kids who do get sick there winding up in hospital. It is a low number, but warnings now that could change. Back to school time, you factor in the Delta variant, which is so much more contagious, and one paediatrician that we spoke with said the picture could soon look very different.
The more people that you have infected, the more likely you are to potentially have cases that wind up being more severe and more spread to people who are more vulnerable and have underlying conditions that can, make them at risk to get sicker.
And if they're getting sicker, potentially more could end up in hospital. There could be more ICU cases, Heather.
That is what we're learning out of Manitoba specifically, Laura. What about the picture in the rest of Canada?
Yeah, I've taken a look at this morning, and when you look at Canada, since the beginning of the pandemic, 18.6% of total cases across the country have been in a group aged 0 to 19. Now, that is just shy of 1/5 of all cases, but there is evidence that that number is growing among kids. That is obviously a concern. It's a concern right across the country at back to school time, especially because many young children aren't yet vaccinated. You have a patchwork of rules around teacher vaccinations, around masks in schools, some provinces mandating it at all times, others leaving it up to school boards. As I mentioned, kids generally don't get as sick as adults with something like COVID-19, but they can have really problematic symptoms, unusual symptoms, long COVID, and that of course can keep them out of classrooms for longer. So the message we are hearing from experts about all of this, Heather, is that need once again for adults to get vaccinated to help keep those kids safe until they themselves can get their shots.
One of the things we'll talk about with Dr. Bogosh coming up later this morning. Thank you very much. Good to see you, Laura McQuillan.
Good to see you.
This morning. Thank you.